After you perform your first visit in Meditech and you answer the question, admit to therapy services, yes, in the complete visit page, you will get a contribute to service plan task once that first perform visit task is finished. This task is extremely important as it allows you to make your contribution to the patient's plan of care. So once you see this task, you should do this immediately after you finish your evaluation. Consider this as part 2 of your evaluation. For those of you coming from paper, this is the equivalent of the goals and interventions form. For those of you from Allscripts, this is the equivalent of the problems tab where you set up your goals and interventions. So you click on it and click begin. And once the tasks open, again, it defaults to your first page is your patient overview. You'll have patient status page, which again can give you the plan period as well as being on the patient overview. You have the medications page, the lab results page. The orders page is where the nurse puts in the orders for the patient. And now care plan. This is really where the focus for rehab is. This is where you're going to add your goals and interventions for the patient. So over on this side is the service plan. Now here, when you're clicking on the first line of the service plan, goals and interventions, you want to add your discipline's protocol. So if your discipline is not listed here, we need to add the protocol. All a protocol is a group of goals and interventions for your discipline. So you click the Add Remove Protocols button, and you select your discipline from the area called Standard Protocols. So you're going to come down and click in the box. It doesn't work if you just click on the word. You actually have to click in the box. Be careful here. You do not want to unselect any other discipline because then it will remove that discipline's goals and interventions. So just make sure that your aim is true when you're in the selected box and you're selecting your goals and interventions. Once you're done, click Save down at the bottom right. When it returns you to this page, your protocol is now listed here and the date that you put it on. And we're going to scroll down until we find your disciplines. So now here, you're going to look for the discipline with your goals with your discipline. So they're broken up into care need. A care need is just a category. If you can't read everything that's here, if you just click on the 3 dots, it opens up a pop-up that lets you read it. So under each category, so this is the prevent secondary medical complications. So the first goal is prevent respiratory complications. So the way that you decide whether or not to keep a goal or intervention is to see if you're going to do the intervention that's listed underneath. So if you're a physical therapist and your patient does not have respiratory issues and does not require chest PT or breathing exercises, these are not needed for the care plan. So we want to change the status of the goals and interventions to not needed. We strongly recommend that you do this because we want to be able to easily pull the goal and intervention back if things change down the road, if the patient does develop some respiratory issues. In that case, you would open up the care plan again in a different task called Modify Review Care Plan and change the status back to in progress if necessary. So then you just keep clicking down the rows, and the next long-term goal is prevent skin breakdown. So are you going to be teaching these things? If yes, leave it there. It defaults to being there. So when you add the protocol, you're adding everything onto the care plan. You just have to take out what you don't need. So you would just click down the rows and then decide whether or not you're going to do those interventions or not. So you may come across, for OT and PT, there's a care need called Improve Infant Motor Skills. If your patient is not an infant, obviously all of these are not needed. So if something is not needed and will never be needed because it is inappropriate for either the patient's age or functional level, instead of marking them all as not needed, what you can do is just click on it one more time and get the drop-down menu. And then you can just delete that whole section. If there's just one particular goal, let's say, we'll use this one as an example. If there's one goal that's not needed, you can just click on that and the menu comes up for delete goal. If there's one particular intervention that is inappropriate, you can delete that individual care step. But like I said before, we would rather people change things to not needed rather than deleting it, because it's relatively difficult to bring something back onto a care plan once it's been deleted. It's really easy to come in and change the status to in progress again. So that is how you make goals and interventions come off of your care plan. So once you've edited your care plan and the care plan truly reflects what you plan on doing with this patient, you can click next. The next page is the patient schedule. So this is just another opportunity for you to come into the patient schedule. You can set up the auto plot preferences, and you can also schedule out your 60-day summaries, coordination, and managed care summaries. I will be teaching that in a separate video. Resource plan is the next page in this task. Now, resource plan is you're not required to do anything, but it is a nice way to kind of give yourself a little chart review. So it defaults to the current certification period. It tells you what their action level is, the team, care coordinators, the case placer, the scheduler, and who the primary nurse is on the case. Now you can scroll down to your discipline, and under your discipline, you can see how many visits are planned. These are all the visits that are on your schedule for the entire cert period. It tells you how many visits are authorized. So if you're also looking for another way to look up your patient's authorization information, you can definitely review the resource plan page, come down to your discipline and click authorized. And here it tells you that authorization is needed for 21 remaining physical therapy visits, and that you only have 7 authorized, and these are the visits that are authorized so far. You can see the visits that you've performed. You can also view the notes from here. And unreconciled, how many visits are remaining, visits that were missed or rescheduled, and any PRN, but PRNs are for nursing only. So the resource plan page is just a way for you to kind of have a little mini chart review. So the last page of this task is called Apply Signature. It is what it says. You can come down here. Now, your resource class status, once you have established your care plan, you've added your protocol, and you've marked goals and interventions as either not needed or deleted them, you're not pending contribution anymore. You need to change your status to active. Your discipline is active on the case, and then you would apply signature. If you finish this task and leave your status as pending contribution, this task will just stay on your task list until you come in and say that you're active and apply your signature. So that, just to review, the Contribute to Service Plan task mainly focuses on your care plan. You're going to add the protocol for your discipline, scroll down, and change the status of goals that you're not going to be working on and interventions that you're not going to be performing. Change those statuses to not needed. You can delete completely inappropriate goals or interventions. and then come to the Apply Signature page. Change your resource class status to active and apply your signature. Once you're done with that, you can click Finish. And the Contribute to Service Plan task will come off of your to-do list.